If someone in your family has kidney stones, you're more likely to develop stones too. And if you've already had one or more kidney stones, you're at increased risk of developing another kidney stone. Passing kidney stones can be quite painful, but the stones usually cause no permanent damage if they are recognized in a timely fashion. My name is Joanna Mambia, and here's what's ahead on today's episode of Health and Flavour.
I don't.
Okay, thank you.
The fruits have kiwi, they have bananas. If you had mangoes, because there are also some mangoes here, we also have some avocado.
Drinking extra water dilutes the substances in urine that lead to stones.
We headed out to the streets of Nairobi to find out if people understand what kidney stones are, and this is what we gathered. Hi, what's your name?
My name is Yandru Ambeza.
Do you know what kidney stones are?
Don't know.
Yeah, kidney stones is a condition whereby someone does not take a lot of water and intakes a lot of salt, and then it forms some stone-like substances in the kidney. Yeah, so it causes a lot of pain. I think someone should take a lot of water and also reduce the intake of salt. Yes, and also visit a doctor.
Hi, what's your name?
My name is Amon Tumbo.
Do you know what kidney stones are?
I don't.
Kidney stones are rarely diagnosed before they start causing pain. So what steps should you take to prevent yourself from this occurrence? In the next segment, our nutritionist Hesperance Deodate will advise on dietary modifications you can make to your lifestyle so as to prevent and manage kidney stones. Stay tuned.
Sometimes you have this pain that comes in waves, fluctuating. It is moving this time you feel it this way, in this side, and another time it is fluctuating, it is moving to another direction. And another symptoms could be pain on urination. It is very important normally to open our eyes when we are urinating. See the color and judge yourself if that is the color. Because when it is pink, red, or brown, then that is one of the signs. Are you nauseated? It is not a normal feeling. So when you are nauseating or you are vomiting, do not take it lightly. Or sometimes you feel this urge to go, persistent need to urinate. Then you need to ask yourself, why today? Why is it so bad today? Then that is one of the signs. Sometimes you've not taken enough water, but you urinate more often, little peas, then that is when you know what is happening today. Because the urge is there, but you pass little urine, and then after a while you pass again, then that is another symptoms. Fever, and then urinating in small amounts. Sometimes the color of the urine is cloudy and it is smelling bad. Urine has its own smell. Yeah? But now this one, you feel that it is different. Then there could be, that is one again of another sign. Or burning sensation during urination, or persistent urge in urinating. Now, pain caused by a kidney stone may change, shifting directions. That again, it is when the stone is moving. Now, when do you seek medical attention? Seek medical attention when you have severe pain, or when that pain is accompanied by vomiting or nausea. Also seek medical attention when there is fever. What if there is blood in your urine? Or what if it is difficult for you to pass urine? Seek medical attention. There could be a bigger problem. So you need to seek medical attention. Sometimes we experience the lower back pain. Yeah? Persistently seek medical attention. Okay? When the urine is cloudy and foul smell, seek medical attention. What if you lose consciousness? Definitely the people around you should take you to the hospital. Now that is when you need to go seek medical attention. What are the causes of these stones? What are the causes? Remember, this is cinnamon water. No honey, nothing inside except the sticks of cinnamon. The causes of these kidney stones, one of the causes may be when your urine is more concentrated. It has more crystals forming substances such as calcium oxalate and uric acid than the fluid in your urine can dilute, because normally they are supposed to be diluted. But when they are more concentrated and then your urine is not able to dilute them, then they will form stones. So these are minerals, normal minerals. Another cause could be urine which may lack those substances which are preventing the stickiness. Okay, again, there could be another problem. We need to talk about these types of kidney stones. Okay, if you know the type, then you will know how to reduce the risk. There is calcium stones. More kidney stones are calcium stones, usually in the form of calcium oxalate. Now, oxalate is a natural occurring substance found in food, and it is also found in, your liver is also manufacturing it, but it is in most fruits and vegetables, and it is in nuts, yeah, but also in chocolate. Again, these calcium stones, they are also caused by high doses of vitamin D. We do supplements, but we also need to know that your body do not need enough. I mean, it does not need more than what it needs. So when we take more than it requires, we also jeopardize the situation in the kidney. Now, whenever also we have intestinal bypass surgery, yes, that could also cause another problem. Now, what about several metabolic disorders? That could be another cause. Now, these calcium stones may also occur in the form of calcium phosphate. Calcium phosphate is more common in metabolic conditions such as renal tubular acidosis. Now, calcium stones in form of calcium phosphate, it may be associated with certain migraine headaches or taking seizure medication. So some medication also may cause these kidney stones. Then again, we have struvite stones. These form in response to an infection such as urinary tract infection. These stones can grow quickly and become quite large, sometimes with little or no warning. Then again, we have uric acid stones. This is formed only in people who do not drink enough water. Again, there are people who lose fluid so quickly. They take some medication that is enabling them to lose fluid, and it is quickly. Then they might be in danger of developing these uric acid stones. Now, uric acid stones, those who eat high, then they eat the diet which is high in protein. But also we have patients who have gout, and because of some certain genetic factors, they can also develop these uric acid stones. Now, cystine stones, these ones are forming in people who have hereditary disorders that cause the kidneys to excrete, to excrete too much amino acid. Now, what are the risk factors? The risk factors which cause the development of the kidney stones. Now, factor number one, it is dehydration. You do not drink enough water. That is number one. But certain diets, too much animal protein, again, too much salt, okay, that could also be another problem. Do you have a family? Or let's talk about yourself. Have you ever had these kidney stones before? That is an indication that you might have it again. So you are at risk of developing more of these stones, being obese or having digestive diseases or digestive surgeries and other medical conditions. What are the complications? The main complication is blockage. When the urinary tract is blocked, then it means you are not able to pass urine. Now, there are natural remedies. Now, the natural remedies on how you can go about it, this is how you should do it. Even if you have not been diagnosed, try this today. And I just want to take you through several. But some of the natural remedies that you will like, some of them, stay with alkaline diet, raw food, whole, fruits and vegetables, and raw nuts. Those ones are just some of them. But the first natural remedy is water. Water is treating it, and it is also preventing it. Drink water and drink water and drink water. Another thing that will truly bless you is celery. This one, celery. Celery is highly alkaline. You can throw it in your salad, fruit salad or vegetable salad, or you can simply chew it. It is something good. It has oxidants, but it has a certain compound in it in form of this antioxidant that is blessing you to have increased urine, which is coming with this much pressure. So you may need it to help push those stones if they are stuck somewhere. We definitely have them, so it is just good to take precaution. Sometimes this is what you can do. You can simply take these sticks and then throw these sticks in a glass of water or in a jug of water. When this happens, then you know what? You are releasing the nutrients through osmosis. The nutrients that in this celery, you are releasing them in water, and then in turn, this one is also taking the chemicals that are in water, and they are being absorbed and they stick in this one. So that exchange, when it happens, then you take your water, which is slightly ionized, alkaline water, and then it is also blessing you. You know, these are beans. There are people who will say, we do not want to drink, to take beans. This is what you can do. Boil these beans, the ones that are in dark colors. Boil them, then drink that water. 2 to 3 glasses of water. Let them take the beans, you take the fluid. It is also an excellent way of pushing it down, removing it, and also preventing the formation of those stones. There's another thing, lemon. Lemon juice contains citrate. This citrate, it is a compound that is helping to break down these calcium deposits. So if your stones were calcium in nature, then, and you are breaking them down, then again, you are safe. So this is what you can do with the lemon juice. Every morning when you wake up, the first thing in the morning, the moment you say, oh, thank God I'm awake, and you have already said, thank God I'm awake, it is a new day, all right? Then take lemon juice, and then you have your flask of warm water, and then sip it. Take that warm water, 2 to 3 glasses, and then you go and exercise, because exercise is a must. Then after exercise, then come back again. You might need to take green juice. This is spinach juice, dark leafy, yeah? When you are taking this one, make sure that you have a squeeze of lemon or citrus, lime or orange, or sometimes even pineapple. You can also add garlic, or if you are a spice person like me, garlic or ginger, or even turmeric. Take a glass of water when you are coming from exercising. You have burnt calories, but you have produced some lactic acid due to exercise, but also you have released some of the acids, and your body is in need of those nutrients. So make a glass of juice like this one and take it down. You will feel very good, but you are creating an environment whereby these stones are not allowed. So it is another way of saying, no, I don't want it. Then there is another compound that is stabilizing the uric acid. That is basil. Take it and then make sure that you put it in water, let it stay there, drink the water, or even crush it. Sometimes if you find it dried, then make sure that at least it is somewhere. You can also add it in hot water and drink it. Then we have this thing we call apple cider vinegar. This one has citric acid. It is dissolving calcium deposit. You know what to do? Just put it in a glass of water, this one, warm water, and then drink it in the morning on an empty stomach, or take it in the evening before you take your meal. You just add 1 teaspoon or 2 teaspoons in a glass of water and drink it. It is naturally, you know what? The moment you assist your kidney into neutralizing or dissolving this calcium and uric acid, it means you will not have the stones. There is another thing which is extremely very good. Extremely, I do not know if you know the meaning of extreme, but it is extremely very good. And it is something that you can grow it anywhere, or in a basin, even in a bowl. It is wheatgrass. Take your whole wheat and put them in your garden. And then when they have reached this age, pass a scissor, take them, wash and blend. Wheatgrass juice, it has a compound that is increasing urine production. So when that pressure is increasing, let me tell you, pew, 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 and it is melting those ones. It is dissolving the stones. And you see, it is blessing you even to remove the excess water, the water that is just stagnant in your body. It has many benefits, plus. Antioxidants, some chemicals, phytochemicals. It also has some vitamins, some minerals, some protein. It is just what the body needs. It has more. It has more. But today, because we are talking about kidney stones, the wheatgrass will also bless you not to have these stones. Then, we also have the olive oil. This olive oil, I will tell you, if you have decided completely to say, I do not want and I want to prevent myself permanently, you do this. 3 days, drink a lot of water. It could be plain, but why don't you just add some little things, celery, it could be spinach, lemon water, or vinegar water. You're hydrating yourself so well, but the only thing you are eating, one meal, like at 11 in the morning, it is fruit salad. One meal, fruit salad. And then again, another meal. On top of hydrating yourself, you have another meal of fresh vegetable salad. This is probably around 4 in the evening. And all you are doing is hydrating yourself. Then you are doing that consecutively for 3 days. And you know what? Then take that concoction. An equal amount of lemon juice with an equal amount of olive oil. Blend them together. Then drink it. Go to sleep. They will come out. You will remove them. And it is extremely very good. It is just a good practice for your liver. It is a good practice for your pancreas. It is a good practice for your kidney. It is just a good practice. Yeah, good practice. There are a lot of juices that are very good. Orange juice, pineapple juice. Yeah, all these are very good. You hydrate yourself with those ones, but they are stopping and they're reducing the formation of these stones. We have pomegranate juice. We have dandelion juice. We also have these are the juices, coriander juice. All of them are very good. Now, there's something that I want to make for you this in this session. I also want to give you something else that you will really like. Before me is coconut. This is coconut, fresh coconut. And I want to make milk out of it. I just want to assume that you have some stones and they need to go. They are not part of us. They are causing harm. And so we want them to go. So this is what we can do. In these 3 days, another meal that you can take before going to bed, it is this milk. See what I'm going to make for you. I'll add some little water because I'm just about to sieve the milk now. The milk is ready. So I will add some little water. Okay. I will sieve it. You see, I have the milk. Okay. I'm going to use the same blender. I'll just squeeze in because I don't want to lose any coconut milk. And with this milk, I will have added whole grain oats. But with the same milk, this is what I'm going to do. I want to blend in some herbs. The first one to go in the blender is mint. Mint and blender, mint and garlic are friends. All right? Mint and kidneys are very good friends. This is coriander. Coriander and your kidneys are very good friends. Sorry, I will put some little, the leaves of celery, some little celeries. Okay, some little celeries. And then I'm going to add the milk, coconut milk. And I will also add some nuts. Excellent meal. This is few cashew nuts. I will add 2 or 3 seeds of walnut. Okay, this is one. The other one is half, so I have put 2. And I'm going to add some fruits. We want to prepare a meal. The fruits have kiwi. They have kiwi. They have bananas. If you had mangoes, because there are also some mangoes here, we also have some avocado. And this is what I'm going to do. Do not forget, we have natural things like turmeric, which are very good friends with your garlic. Now, I'm going to blend it. This is a meal and a half. Remember what you've eaten in the morning? You've taken fruits, and late in the afternoon, around 3, you've taken your bowl of salad. You've been hydrating yourself, and then you decide that this is your dinner. You go to bed. But in this manner, you have been hydrating yourself with all kinds of liquids. You've been using lemongrass, you've been using mint water, mint juices, spinach juices, you've been taking the cinnamon water, you've been taking cardamom water, all these drinks, you've been hydrating yourself, and this is how you go to bed. You have never blessed yourself so much like this one. And let me tell you, you don't just bless your kidney. You don't just say no to kidney stones. You will have blessed your brain, your blood, your liver, your kidney, your pancreatic cells, your spleen, the whole of you, your skin, your muscles, even your age, because this meal is age-defying. Remember, if you do not want kidney stones, the only way you can say, I do not want kidney stones, is to change your lifestyle. And this is how you can do it on a natural way. And these are the natural remedies for dissolving your kidney stones. Thank you very much, and be blessed.
Kidney stones may form when there's a change in the normal balance of the water, salts, and minerals found in urine. Different kinds of changes result in the different types of kidney stones. There are many factors that can trigger changes in the urine, ranging from chronic medical conditions to what you eat and drink. Dr. Fesahat Tegaye, a public health specialist, is here to expound more on lifestyle changes you should undertake to prevent yourself from getting kidney stones.
If you have ever had a kidney stone, you surely remember it. The colic pain can be unbearable, coming in waves until the tiny stone passes through your urinary tract and out of the body. For many, kidney stones aren't a one-time thing, and about half of people who have had one, another appears without preventive measures. My name is Dr. Fesahat Tegaye, a medical doctor and a public health specialist. And I'm here to shed more light on how you can prevent kidney stones. Drink plenty of water. Drinking extra water dilutes the substances in urine that lead to stones. Strive to drink enough fluid to pass from 1.5 to 2 liters of urine a day. Reduce salt intake, specifically sodium. Lots of sodium, which you get mainly through salt, means more calcium in your urine. That adds up your odds for kidney stones. Too little calcium in your diet may lead to kidney stones in certain people. Sodium or salt can cause water retention and lead to dehydration. Particular foods and drinks are unlikely to trigger kidney stones unless consumed in extremely high amounts. Some studies have shown that men who take high doses of vitamin C in the form of supplements are at slightly higher risk of kidney stones. That may be because the body converts vitamin C into oxalate. Avoiding kidney stones means preventing the conditions that support their formation.
Drinking too little water is the most common cause of kidney stones. It may lead to dehydration, which results in urine with high levels of mineral deposits, which can clump together to form stones. Nearly 80% of kidney stones are calcium-based. If you had a calcium stone, cut back on the salt, which causes the body to dispense more calcium into the urine as well as animal protein. The best way to ward off new kidney stones is to drink enough water to keep urine clear. In fact, eating moderate amounts of dairy products and other calcium-rich foods may lower the risk of forming new stones. Thank you for watching today's episode of Health and Flavour. Until next time, I have been your host, Joanna Mambia.